Hey team, it's Amy, your nurse educator here, and today we're going to be talking about what to assess in a patient that is post-surgical or post-procedural. As always, please make sure that you're checking your orders so that you know what specifically to assess, how often, and when to notify the provider. But here are a couple of things that you should be assessing. In general, pulses are a big assessment point for these patients, especially if the provider was working on a specific extremity. You always want to start by checking the pulse in the unaffected extremity so that you have a baseline and a comparison point. Then when you check the pulse in the affected extremity, you can see if it's equal or decreased. If it's decreased, that may be an indication that you either need to call the provider or assess further. Our second P is pee. We want our patients to be peeing appropriately after surgery or after a procedure, as urine can be a big indicator of overall volume status in the body. So we need to make sure that they're peeing appropriately. Our third P is pressure, and this is referring to blood pressure. Now, your provider may set specific goals that they want you to achieve in your patient, but we're really worried about hypotension and hypertension, as that can cause a lot of complications post-op or post-procedural. So be sure to check those orders so you know what your goal is for your patient. Our last P is pain. Pain is a really common issue in patients that are post-op or post-procedural. So be sure to check your MAR so that you know what you can give PRN to keep their pain under control. And be sure to let the provider know if those PRN meds are not keeping your patient's pain under control. Our last thing that we should be looking for is bleeding. Bleeding is something that's pretty evident that we should be assessing for, as this can lead to a lot of complications. One of the things that I used to do as a bedside nurse is anytime I received a patient from the OR or a procedure is I would immediately look at the site that the provider was working on so that I could see if there was any signs of bleeding immediately. After I assessed the site, I would oftentimes put a chuck pad around the site so that whenever I would go to assess it at a later time, I could pull back the chuck pad and I could see the amount of blood that was on the chuck pad. This became a great quantitative data point for me to then communicate with the provider if I was worried about bleeding. I could then tell them how many pads the patient had soaked through in a certain amount of time. So for instance, I could tell the provider, I'm worried that your patient in room 2 is bleeding. They soaked through 1 chuck pad in 5 minutes. That now gives the provider a clear understanding of how much and how fast the patient is bleeding and potentially what type of bleed it is, whether it's venous or arterial. So I would really recommend that you do that, just an easy chuck pad around the site, and that really does enhance your assessment of this patient. So again, I hope that those tips helped you. Always make sure to know your orders for these patients. Click that subscribe button if you want to see more of my videos, and I'll see you next time. Bye.